Hi, today I'm going to show you how to use the cervical collar using the Nexus rule. The rule is governed by the posterior midline spine tenderness, evidence of intoxication, the GCSE less than 15, altered mental status, less than 5 verbal, neurological deficit and painful distracting injuries, especially in the spinal area. Okay, so hi, I'm Tabby, how are you? Well, obviously not too good. I'm going to apply the C-collar as you look like you've had a bit of an injury to your spine. Is that okay?
Yep, that's all right.
Yeah, okay. So I'm going to measure the spine by using, measure the collar, the distance, sorry, from the head to the shoulder, and it's 3 fingers. So I'm going to actually measure now the collar, and I'm going to alter the collar to it's a short neck, which is already on it. So, okay, if I ask for my assistant to come and hold the head for me, thank you. I'm just going to apply the collar, okay? Does that feel secure enough and tight enough for you? It's supporting your head?
Yes.
Okay. First of all, I'm going to tilt back the patient's head to open up the airways and just do a quick sweep to make sure that there's nothing blocking the airways. I'm going to take the OPA and I'm just going to measure from the corner of the mouth to the corner of the ear roll to make sure that it fits, that it's the right size. Now I'm going to place the curve end into the roof of the mouth, and then I'm just going to turn it 180 degrees so that it slots into the back of the throat. And so then it's in. Okay, so I'm going to pick out one of the MPAs, and I'm going to check that it fits just by measuring the nostril to the earlobe to make sure that it's the right size. This one is. Then I'm going to apply a bit of lube. Okay, and then I'm going to insert it at a 90 degrees angle into the nostril. Okay, and that's sliding in nicely. If you feel a bit of resistance, you can turn it 180 degrees. Oh, and it's a bit more resistant, so I'm going to turn it another 180. Okay, so make sure that the MPA is level with the nostril, just like that. If you find that you can't actually go into this nostril, then you can always use the alternate nostril as well. Okay, so now I'm going to show how to use the suction with the powered unit. First of all, we're going to test that the machine's working, so we'll turn it on to full power and we'll bend the tubing. And while we're bending the tubing, we want to notice or want to make sure that the lights are lighting right to the top. This means that it's ready to use. Okay. Next, also as well, there's normally a water bottle there that if the suction gets blocked with vomit or something like that, that we can actually flush it through and clean it out. Now I'm going to just close the circuit here over the hole. I'm just going to tap on my hand to see that the suction's coming through. Then with my patient in a recovery position, I'm just going to place the suction into the patient's mouth and use a circular motion around there to start sucking out all that's inside, coming out of the side. It should be used for longer than 10 seconds at each time. Today I'm going to show how to demonstrate hemorrhage control and wound care. Okay, so I'm going to start off with the gauze, and I'm just going to clean the area, so I'm just going to saline solution the area to make sure it's clean. Also I'm going to apply some saline solution on the gauze too, so it doesn't stick to the cut when they get to hospital and want to take it away. Okay, I've folded it into the smallest possible squarage so it adds more pressure. I'm just going to apply that directly onto the wound and then get the bandage. I'm just going to place that on top. I'm just going to come round and first of all, cover the bandage. Sorry, cover the gauze with the bandage. That's covered. Okay, now I'm going to do a figure of 8, and I'm just going to turn it as well. This adds more pressure to the area. Okay, and I'm just going to check that there's still some sensation at the end of the fingers. Is that okay?
Yeah.
And I'm just going to press onto the nail base to see if the colour comes back. And if you could wiggle your fingers for me, please. There we go. Can you still feel it's all fine circulation?
Yeah.
Hi, today I'm going to show you how to manage a catastrophic hemorrhage. I'm going to start off with a tourniquet, and I'm just going to place the tourniquet on the arm, above the wound, about 10 centimetres above the wound. And I'm just going to tighten it using the Velcro, making sure that it's nice and tight. And then I'm going to turn that, and then just place that over the top, and I'm going to record the time that I've actually put the tourniquet on, which is 20 past 2. So I'll record that. Now I'm going to just feel for the radial pulse to see if that there's any pulse. No, I can't feel any pulse, so I know now that it's cut off all the circulation. If it doesn't stop the bleeding just using one tourniquet, then I would put another one on just above. Okay, before we approach the scene, I'm going to check that me and the crew have got the RAT PP equipment on, which is gloves and glasses. Okay. Also, I'm going to check that there's no danger around and the scene's safe to approach, which is fine. Hello, sir. Hi, sir. Can you hear me? Can you hear me? Hi. No, the patient's not responding. Okay, I'm just going to check airways. There's no blockage at all. Okay, I'm just going to listen to see if I can hear any breath. Okay, I can't feel the chest moving at all, and I can't feel any breath. Okay, I'm going to just call for help. If you could commence CPR, great, thank you. AUT 1, got an R49, please can I have an R50, please, thank you. Okay, if you could commence with 30 compressions. Yep. I'll start the defect pad. Okay, I'm just going to place the pads on.
Analyzing heart
Okay,
rhythm.
stand back for me.
Do not touch the patient.
So keep it clear. And stand back.
Shock advised. Charging.
Again, shock.
Stay
Stand back.
clear of patient. Deliver shock now. Press the orange button now. Shock delivered.
Okay, if you can commence CPO, please. Great.
Start CPR.
Okay, I'm just going to check my mask for oxygen. Okay. Yep, that's working. Okay, I'm just going to apply an OPA. Great. After your 30 compressions, I'm going to do 2 compressions of air. Chest is rising nicely. Okay, if you commence CPR. Great. Has anybody seen, anybody know this person at all? Anybody see Harry fall or any history, any person know this person? No.
Clear of patient.
Stay clear. Everyone stay clear.
Analyzing heart rhythm. No shock advised. Pause.
Okay, I'm going to commence
If
CPR.
needed, start CPR.
Okay, now I'm going to show you how to use a LifePak 12 ECG. First of all, we turn round to the back, and we can see that we've got the battery packs. We're just going to press, and we can see that the green there is lit up, so we know that they've got enough battery life in them. If we had to take them out, we just simply push at the side, and then they just slot out like that and slot back in. Okay, in this end we've got the defib and the test loader here. So this is the defib cable and the test loader, and we've also got the defib pads. We should check as well that the defib pads are in date. This side over here we've got the ECG 4 lead cable, which I've already attached it to myself, so that's in here. We've also got a razor and some Disprin and some spray that goes under the tongue. Here as well is the CO2 tester. Basically this bit here goes into this tiny slot on the side, and it just screws in. You can see it just screws into there gently. Okay, and then you just breathe through that end. And also we've got the SBO2 cable here, and the BP cuff is just at the back here. Okay, so I'm going to start off by turning ECG on. Okay, now I'm going to
connect electrode.
switch it into manual mode. So I'm just going to turn that and press. I'm going to do a test shock, so I'm going to just turn this down to 50 joules. Okay, and then I'm going to press options, and I just want to do a user test first. Let's go into the user test. So now the user test is in progress, so this will check to see if the machine's working fine. Okay, and it's just printed off a test here, and it says user test has passed. So I'll just tear that off. Also as well, before I could have done the test, I should check to see if there was enough paper, which is just in here. It's a little roll, and it just comes out like that, and you can change it over. We've got enough at the moment, so that's great. So put that back in, and just pull it like that, and that just closes. Okay, now I'm going to move on to a charge. So I'm just going to connect the test load inside, and then I'm going to press
Analyzing now. Stand clear. No shock advised. Start CPR.
Okay, so now I've just gone into shock, and this is charging now onto the life pack, and now I just press the shock, and I've administered a shock, and it says the energy is delivered. So now I'm going to show you how to disarm one. So again, I'm going to press the charge button, and then just before it gets to the end, I'm just going to press in the selector button, and that's disarmed. Okay. Now I'm going to switch over to the ECG. Put that back in. So I'm just going to get it into manual mode, and I'm going to go into leads. So to change the leads, you can go down to the 213 or the 23 AVF, or just by turning the button you can change and select whatever lead you want. Okay, now I'm going to go into the size as well. At the moment is this kind of size. If you want it bigger on the screen, turn the knob again, and as you can see the size is changing, it's going bigger. And if you want to keep that size, then you just press the select button. But I'm going to change it back to small again. Okay, and then it will change back into small. Okay, I'm now going to go over to the sound, and this will adjust the QRS volume, and then we just turn the knob again, that will go loud, and you can turn it the other way, and you can hear in a minute that it will go quiet. There you go. And you can turn it off as well. Okay. Oh, and I'm just going to go home screen to get back to where I was. There we go. Okay, I'm also going to test the SpO2s. So I'll just place my finger in here. And this in a minute will pick up my SpO2 reading as well. Okay, now I can just press print to press out my reading. Or to print out my reading, sorry. As you can see, it's coming through. Okay, and I press print again just to stop. There we go. Also as well, I just want to point out that there is a nib button here. So you pop on the cuff onto your arm and just press the nib button. Okay, so after I'm finished with the patient, then I will just take off the leads and wipe them down with some antibacterial wipes and make sure I pack all the pieces away in the appropriate places. Okay, now I'm going to show you how to use a bag valve mask. We have to check firstly that there's no holes or that the bag is damaged in any way. Yeah, which this looks fine. Okay, now I'm going to turn on the oxygen. And I'm going to put the oxygen rate to 10 to 15 litres per minute. And we can see that the bag now starts to inflate with the oxygen. So this is showing as well that there's no leak in the bag, which is really good. Okay, before I do that, I'm just going to pop in an OPA. I'm going to tilt the head back. And pop in an OPA there. Now I'm going to hold the bag, the actual mask, and I'm going to place it over the mouth and the nostril, and I'm going to place it just there, and I'm going to hold it in a C grip, so it's right under the chin, so no air is able to escape. And then I'm going to press the bag and watch the chest raise. That's how I know that the oxygen's getting in and inflating the chest. And then after about 7 to 8 seconds, I'm going to do another press of the oxygen. Okay. 1, 2, 3, 4, 5, 6, 7, 8. Okay, so I'm going to assess this patient for a fracture. And first of all, I'm going to explain the procedure and get consent. And so I'll start off by exposing the area where we think the fracture is. So we're actually exposing the bad leg, and we're going to expose the good leg, the uninjured leg as well. Okay, so I'm suspecting it's the right tibia. I'm going to use the acronym plus discs to actually analyse the patient for a fracture. The first being pain, second loss of movement, unusual movement, swelling, deformity, irregularity, shortening, crepitus and shock. Once I've completed that, I'm going to feel for cardiovascular integrity. And we'll start by testing both legs, both the injured leg and the uninjured leg, to compare the difference between them. So I'm going to feel for both the distal pulse, I'm going to be feeling for temperature, I'm going to be looking at colour, and I'm also going to be comparing the capillary refills and seeing how long it takes for them to refill. I'm also then going to compare the neurological integrity, which is I'm going to ask for the feel sensation, if they can feel me touching their foot. Also, I'm going to ask them if they can move their ankle and move their toes as well. And then I'm going to come back to the patient and ask about his pain. I'm going to give him a scale saying that 10 is the most intense pain that you could never ever bear. It's like huge pain, and 0 being no pain at all. And I'll ask whereabouts in that scale that he will fall. And then once I've done that, then I'll move on to providing pain relief, which is suitable for his pain. Hi, I can see you're in moderate pain there. So I'm going to offer you some pain relief. Is that all right?
Yes.
Okay, I just want to ask a few questions first before to make sure that you're able to have the medication. the pain relief. Okay, so have you been scuba diving in the last 24 hours?
No.
Okay, I don't suspect a pneumothorax. Do you have regular bowel movements?
Yes.
Okay, and obviously you're able to obey commands. Do you have any known allergies at all?
No.
Okay, wonderful. Okay, so I'm going to offer you this pain relief. It's called Entonox. It has a few side effects, which you could feel a little bit nausea. You could feel, you could taste a metallic taste. You could feel very euphoric. Also, you might get a bit of echoing sound in your ears, and you could get a bit of sedation if you have too much. But generally, most people find that it doesn't really affect them that much, so it's a lot more beneficial for you to have the drug. Is that okay? Would you like to have some pain relief, some Entonox?
Yes, please.
Okay, so it's self-administered. What you have to do is you have to place the mouthpiece into your mouth and take 5 to 6 really deep breaths for me. Once that happens, about 5 to 6, you'll start to feel the effects and the pain will start to ease away. And after about 2 to 5 minutes, possibly if you feel the pain starting to come back, then you just get back on and you take some really nice big deep breaths for me. Okay?
Yes.
Okay, I'm also going to govern before I actually administer. I'm going to go by the 5 R's, which is the right drug, the right dose, right patient, the right route and the right time. I'll also get one of my colleagues as well to double check to make sure that it is Entonox on the tin that I'm going to give, and yeah, check all the R's basically. Okay, sir, I'm suspecting that you've got a right tibia fracture. So I just want to, now you've had your Entonox, the pain relief, I just want to check how that's working for you. How's the pain? 0 being no pain and 10 being absolutely disastrous, like your arm was ripped off.
I think it's 4.
About 4. Okay, so we're getting the pain under control. Good. Okay, so what I'm going to do is I'm going to actually put a box splint onto your leg, and this will help support and mobilize your leg, so that will help you feel much more comfortable as well, and it will ease the pain as well. Okay, so I'm going to ask my crew member to, if you could raise the leg for me please, while I place the box splint underneath. Great, thank you. Okay, is that okay? Okay, I'm just going to secure it now. Okay, I'm just going to check your neurological integrity. Can you feel this sensation on the bottom of your foot?
Yes.
Okay. Where else can you feel that I'm touching?
On my foot, my right foot.
Yeah. Okay, great. Can you wiggle your toes at all?
Yes.
Great. Okay. I'm just going to check the cardiovascular circulation. So I'm just going to press on your toe. Is that okay?
Yes.
Okay. Yeah, I can see that the blood's coming back into your toe very quickly, so that's absolutely fine. Also, I'm going to check the temperature to make sure that they're both still the same temperature, which is fine as well. Okay, sir, so you're nice and supported now, your leg. How's the pain going? How do you feel now from 0 being no pain and 10 being extreme pain?
Much better. I think it's 2.
2, great. So we've got the pain under control. Okay, and we'll just take you straight to the hospital. Hi Rachel, I'm just going to take your blood pressure. Is that alright?
Yeah.
Okay, so what I'm going to do is I'm going to place the band on your arm here, and then I'm going to tighten it up, so you will feel a bit of pressure and a bit of tightening. Okay? But that's all quite normal. Okay, I'm just going to feel for a pulse. Okay, so I found the bronchial pulse. I'm just going to pump up now, okay, so you'll feel it tighten. Okay, your pulse was good. The first measurement that I took was the systolic, and that was 120, and that was when I could hear the heartbeat. When it went down and I couldn't hear the beat any further. That's called the diastolic, and that was just at 72. So that's all within the normal range. So it's good. The normal range for an adult is lower than 140 systolic and 90 diastolic. Okay, so now I'm going to find Charlotte's pulse. The average adult's pulse is from 60 to 100 beats per minute. And what I'm going to be checking for is whether it's a strong or weak pulse, or whether it's regular or irregular, and obviously how many beats per minute. Okay, is it? Hi Charlotte.
Hi.
Is it alright if I check your pulse?
Yeah.
Cool. Okay, found the pulse. So I'm going to start counting 15 seconds. So I'm going to count the pulse and the time of 15 seconds. Okay, that was 20 beats in the 15 seconds. So I'm going to times that by 4, which is 80 beats per minute. So you've got a good pulse there, and there was no irregular or beat or anything. It felt like a really good pulse. Hi Patricia.
Hi, Tab.
I'm just going to check your respiratory rate. Is that alright?
Yep.
So I'm just going to watch for your chest to expand and lower, and I'll be counting how many breaths you take within 15 seconds.
Yep.
Is that alright?
Yep.
Okay, cool. 15 seconds. I noticed that you took 4 breaths in them 15 seconds. So 4 times 4 is 16. So you have 16 breaths in a minute, which is absolutely perfect. The normal breaths per minute is between 12 and 20, so you're as well in the range. Okay, is it okay now if I just listen to your chest?
Yeah.
Okay. I'm actually going to do, so listen to your lungs, so I'm actually going to do this from behind, so it's a bit more easier. Is that alright? You comfortable there? Take a deep breath in. And to the other side. Okay, thank you, Patricia. That all sounds really clear. There's no wheeziness or crackling or anything like that, so you're all good. Okay, today I'm going to show you how to attach the regulator to the oxygen. The oxygen normally comes in a container like this, and it has pressed there on the container. Inside the regulator, there's 2 little nodules here, which actually slot into the 2 nodules on the canister. First we have to check that the seal's okay, and that looks fine, it's not worn at all or anything. Okay, so I'm just going to apply that around. I'm going to apply the regulator so it slots nicely into the top of the canister, and I'm going to tighten up the screw. Once I feel that there's a bit of traction, then I'm just going to tighten it slightly so the ball turns over and it seals in. I'm just going to turn the canister on now. At the moment it's on the red, so no air is coming out. I'm going to turn the canister on, and I can see that there is air inside as it's gone to the green. Okay, so that shows that the air is coming through. I'm going to apply now the nasal cannula. Just turn it, make sure it one's in there. Okay, and I'm just going to turn this one to number 2 on the dial here. This is 2 to 4 litres per minute that's coming through, and this allows for about 20 to 40% oxygen to come through the nasal canister. Okay, I'm just going to now check that there's air coming through, which there is, and I'm going to apply the canister. Okay, so I'm just going to apply the nasal canister to you here, is that okay? So you can get some more oxygen and feel a bit better. Okay, thank you. Just going to apply it to the nostrils, and then pin it behind the ears. went off, so I'm just going to turn the dial back.